Brandon Lewis, you guys, what a patriot. Oh my God, this guy. How many people like Big Pharma in your government, affecting your government and making the government do what they want? There's an organization right over there called Reform Pharma. Extremely important because they are on the cutting edge of changing that in this state, Tennessee. Amy Miller, come on out here. Reform Pharma. She's going to tell you all about it. God bless her.
Oh, thank you. Thank you. Thank you. Yes, I'm Amy Miller, and I work for Children's Health Defense, and I work for the initiative called Reform Pharma. So we dedicate our time and efforts solely going after pharma, exposing corruption and restoring healthcare integrity. Children's Health Defense, for those of you who don't know, we fight for medical freedom, and our chairman on leave is Robert Kennedy Jr. He started the organization, and he is now fighting for children's health alongside of Trump. What I want to share with you today is a little bit about what Reform Pharma has been doing, and then get straight to the separating the state, pharma and state. So Reform Pharma, we've had a couple special projects lately, and one of them is trying to get into the hands of people that we don't normally touch. And that is, it's been kind of fun. We thought out of the box. And I don't know if you guys haven't stopped over at the booth, we have a comic book that we put out, and it is we came up with a superhero. Her name is Theta, and she represents the people. So all of you are represented by Theta, and she fights for the people. She doesn't have a superpower. She's one of us. And she inspires you to speak out and be bold. But it's based on the illegal biolab that the CDC actually swept under the rug in Reedley, California. They had Ebola, SARS, COVID-2, they had HIV, and when they called upon the CDC to get help, what happened? The lady, the cold enforcement officer who found the lab, was hung up on. So we exposed the CDC director, Dr. Mandy Cohen, and showed in the comic book how this is what they treat the American public like. And she's going around, Dr. Mandy Cohen is going around the country tooting her own horn, saying, trust and transparency, but sweep it under the rug and then go get your kid a COVID shot while you're at it. What? The COVID shot should not even be on the market. And that leads me to separating pharma and state. In the state of Tennessee, I cannot tell you how many times I have talked to legislators. I've actually been doing legislative work for about 10 years in the state of Tennessee. And I have heard so many times, but we don't mandate the COVID shot in Tennessee. It doesn't matter. It shouldn't even be allowed to be a yes. It should not be on the market. It is so dangerous. And here, Dr. Mandy Cohen, the CDC director, keeps pushing it for 6 months and older. That is ridiculous, and our state should have no part of that. However they do. So I'm going to put down my comic book really fast. And I have some paper. I normally don't carry this thick of paperwork, but I wanted to share with you exactly what I'm going to be talking about. The need for separating pharma and state is so big. How many of you guys are surprised that pharma, big pharma, has a stronghold on the state of Tennessee? No surprise, right? What's surprising is how much we dig in. At Reform Pharma, we have an attorney, we have a research person who digs like I've never seen anybody dig before. She actually lives in the state of Tennessee. We have social media people. So we try to get the word out of what we see and what we find. And we're not surprised by Big Pharma, but the fact that our state, who's supposed to have the best interest of its citizens, contracts with organizations that are the tentacles of Big Pharma, like the Academy of Pediatrics, is mind-blowing. Because I'm looking at a contract right now that went into effect in 2022, and it ends in 2025. It is around $1 million, just shy of $1 million. The nonprofit corporation of the American Academy of Pediatrics receives this contract from TennCare, and that says that this contract was submitted and approved as required. The Tennessee chapter of the American Academy of Pediatrics is the only organization providing statewide practice level quality improvement support for improving well child visit rates and immunizations. Okay? So now that we know about this contract, I'm going to tell you, let me flip the page really fast, because it also goes into mental health care, which we all know there was a big push for mental health help. What they're not telling you is that, well, they're not even telling anybody about this contract. They're just making the contract. But what they're doing is they're in charge of telling people, all the primary care physicians, or any of the physicians really, as well as the state, how to assist in the administration of the COVID-19 supplemental funding to increase well child visits and immunization rates in the state of Tennessee for TennCare members under the age of 21. Here's the problem. Not anywhere in this contract is there anything written about what are the adverse reactions people are having, how much harm are these immunizations causing, and why are we not looking at what is causing autism? It is an absolute, that's the real pandemic actually. It's awful. The rates are increasing, and not one place in this contract are they even looking at that. All they want to do is increase immunization rates and increase your well visits so they can get more money. I just found out by our attorney in our department, actually told me this yesterday. It's public knowledge that the CDC just funded there's like 48 different partners that they're going to have. But the American Academy of Pediatrics just got $68 million to push this junk. And the fact that our state is not saying we have the best interests of our citizens in this state, we can't just push the pharma agenda. We need to ask questions, and in order for you to get money from us and $1 million contracts, we need you to tell us, what are you doing to study the harm of the vaccines? It's awful. There's a book at our table, The Unvaxxed versus Vaxxed. It gives all the data. Basically, spoiler alert, the unvaccinated are healthier, by far. And this is the kind of junk that makes me so upset about our state, because those lobbyists from the AAP come in, talk to the legislators, talk to the Department of Health. I mean, front door, side door, back door access. And it just flows right through. Yes, we'll offer the COVID vaccine. We'll tell the kids at school that they you know what? Let's be real quiet about the exemptions. We don't want them to know about that. That is a problem. We have to hold the state of Tennessee accountable. No longer can the legislators just pass on the buck. Big Pharma works through these public-private partnerships, and so does the state. And they're on their way to increase those partnerships. And that is where we the people come in. We the people are the boss of the entire legislative body, as well as the governor, all the government, right? We the people at the top. And they actually hand out a blue book. I don't know how many of you guys are aware of it, but the blue book is a free book that the General Assembly prints every 2 years. If you look in there at the top, there's an org chart. It actually says the people, then the governor. We need to start speaking up. If you're not talking to your legislators, and if you're not telling your neighbors, I think that's been a theme throughout today. We need to let them know. Stop with the bogus contracts. I'm going to show you something else that I printed off. So the state of Tennessee goes and partners with the American Academy of Pediatrics. There's no conflicts of interest there. Baloney. It says right here, American Academy of Pediatrics. You know who their foundations and organizations representing the top 10 donors. Anybody have any clue? Let's start with the good one. Melissa and Doug. How many of you guys buy those toys for all your kids and grandkids? Melissa and Doug. Bill and Melinda Gates Foundation. Abbott Nutrition, Google. But then when you turn the page, that's when it gets really good because you have Merck, you have Moderna, you also have what we call here Sanofi, but I think it's really Sanofi. Look at this. I'm going to hold it up, which you guys might not be able to see, but they're printed on there. These are their top donors. If you have donors and you upset your donors or don't do what their agenda is, guess what? You don't get the money. This state of Tennessee, what are you doing? You cannot have a contract with the American Academy of Pediatrics. You cannot do it. That is a conflict of interest. And I will tell you, when I first started, probably maybe 2 years into going to the legislature, there was one of the good guys, he says, "Oh, I'm sorry, I have to answer this call." Okay, no big deal, I'll wait. He gets off the phone and he says, "Oh, sorry, that's a call that I can't miss." I said, "Why? Who is it?" "Oh, it's just a call I can't miss." I'm like, you put me on pause, I'm physically in your office, and you have to take a call. Why is this person so important? It is the lobbyist for pharma, for Pfizer. And I said, "But you don't believe in all of that. So why do you put it like that?" And he said, "You just don't want to miss that call." So that's the stuff that needs to stop. You don't give favor to people that are the companies that are killing kids. And we've seen enough with COVID. They've killed enough people. They've killed my uncle in the hospital. They've killed friends. They've killed my parents' neighbors. They've killed enough. I was just in New York the other day for a rally, and I see the big headquarters of Pfizer. It was massive. And I just thought, wow, that's a lot of blood on their hands driving by there. I mean, they have killed so many people. So I want to leave you with this. I've told this story before, and so many people say, every time you're talking, you got to tell the story because of how powerful it is. When I first started with a friend, we were two moms on a mission. And we had no idea what we were doing. We just knew my child, my husband and I, we go to, enter preschool, and they deny her solely based on the fact that she's not vaccinated. Mama Bear rose up, don't know what to do. I'm going to figure it out. So I marched to Nashville. So we get there, again, have no idea what we're doing. And we talk to a legislator, and he says, "Here, you need to meet with this guy." Okay, don't know who the guy is. So we thought, I don't really know what we're doing, but okay. The guy stands up, he's over 6 feet tall. He was like a giant. And he says, "Don't wake the giant. We have more money than you, and we will squash you. It's best just to lay low." And I thought, who are you? Who in the world are you? And why do you speak like that? You clearly missed your mom saying be kind to people and use your manners. So the two moms are looking at this giant, and he had his finger in our face. It was the lobbyist for the Academy of Pediatrics, the American Academy of Pediatrics. He told us, don't open our mouths because he will squash us. We thought, well, that's funny because you're a giant, and here we are in this David and Goliath situation. But here's the deal. We know who wins that situation. David and Goliath, David wins because God wins. God is the ultimate winner. And we know that that's exactly what's going to happen here. If we don't stand up, though, we are going to get squashed. But what's exciting is everywhere I go around the country, I've been from California to New York to the South, all the way around this year. It's so exciting because people are finding their tribe. People are standing up, and people are speaking out. But there are still people who can't find their tribe. So you guys go make friends, invite people in. There are more people like us. There are more people that will stand up, and there are more people that will join us. And when we join in, the huge crowd is going to push back. We, the people, are going to push back, and pharma's going to get squashed. So when we say reform pharma's not going to change their mind. They didn't come in yesterday and say, oh, geez, that was bad. We're not going to do that today. They're not going to do that. They have too much to hide. They can't give it up now. But we, the people, the less we depend on their products, the more we're talking to our neighbors, the more that we're gaining numbers in our groups, that's when the real change happens, and it's happening. It's happening from California to New York to Atlanta to Florida, all the way up. So I'm being summoned that my time is up now, but you can change the state. We can change the state. We've already started. Let's continue. Rise up. Talk to your legislators and talk to your neighbors. Thank you so much. And if you want to visit our table, we have Pharmacide t-shirts, which is the death and injury by Big Pharma corruption. I'd be happy to give you a t-shirt over there.